Welcome to UMCC Medical Consultant Connectors, where your health matters to us. Ever wondered why plaster sores seem to be a common occurrence? They're more widespread than you might think. Plaster sores aren't picky. They can pop up on anyone, anytime. But there are groups that are especially susceptible. Sports enthusiasts, construction workers, or anyone frequently dealing with plasters can find themselves facing this pesky problem more often. And let's not forget our older folks, who, due to their delicate skin, are more prone to these sores. As you can see, plaster sores can affect just about anyone, but they are particularly common among certain groups. So, what exactly causes these annoying plaster sores, you might be wondering? Well, there are several factors at play here, and it all starts with friction. Whenever a plaster constantly rubs against your skin, it can cause the outermost layer to wear down, making room for sores to develop. It's not just friction, though. Moisture also plays a significant role. When your skin is exposed to prolonged moisture, it becomes soft and more susceptible to damage. This is why you might notice plaster sores after wearing a bandage for too long, especially if it gets wet. But there's one more factor we need to consider: skin sensitivity. Some people simply have more sensitive skin than others, and this can make them more prone to developing sores. It could be due to genetic predisposition or even a reaction to the adhesive used in the plaster. Simply put, a combination of friction, moisture, and skin sensitivity can contribute to the formation of plaster sores. But how do you know if you have a plaster sore? Well, plaster sores usually present themselves through a variety of symptoms. You might notice redness, pain, or inflammation in the area. Some people also feel a burning or itching sensation. These symptoms are your body's way of saying, hey, something's not right here. It's crucial to take notice of these early signs. Ignoring them could lead to complications down the line. By recognizing these signs early, you can take steps to treat your plaster sore before it gets worse. Left untreated, what could happen? And how can you treat a plaster sore? Now, these are questions that need answers. Let's dive into the complications first. An untreated plaster sore can lead to a variety of complications, the most common of which is infection. Infections can be rather pesky, causing redness, swelling, and even pus. If ignored for too long, this infection can spread to other parts of the body, which can lead to serious health problems. So, how do we avoid this? Well, it's all about the right treatment. The first step is cleaning the sore. Use a mild soap and warm water to gently cleanse the area. It's important not to scrub too hard, as this can cause further irritation. Next up is ointment. An antibiotic ointment not only helps to prevent infection, but also keeps the sore moist, which can aid in healing. Once that's done, it's time for a new plaster. Now, it's crucial to change the plaster regularly to keep the area clean and to monitor the healing process. Remember not to use a plaster that's too tight or causes discomfort, as this can exacerbate the sore. And there you have it. With proper hygiene, a little patience, and the right care, plaster sores can be treated effectively. With proper treatment, most plaster sores can heal without complications. So don't let a plaster sore get the better of you. Take action and keep yourself healthy. So, how can you prevent plaster sores in the first place? Let's dive right into it. Prevention is indeed better than cure, especially when it comes to plaster sores. A few key steps can make a significant difference in ensuring your skin remains healthy, even under a plaster cast or bandage. Firstly, the choice of plaster is crucial. Plasters that allow for breathability can help keep your skin dry and reduce the risk of sores. Material matters, so opt for hypoallergenic plasters if your skin is sensitive. Keeping the skin dry is an essential step. Moisture can cause the skin to soften, making it more susceptible to sores. So avoid getting your plaster wet, and if it does get damp, dry it as quickly and as thoroughly as possible. Reducing friction is another key preventive measure. Friction between the plaster and your skin can lead to sores. Use padding or a liner under the plaster to minimize this friction. Lastly, don't ignore any discomfort. If you feel any itching, burning, or pain under the plaster, seek medical attention immediately. Early intervention can prevent a small issue from turning into a painful sore. Remember, the best way to deal with plaster sores is to prevent them from happening in the first place. Stay healthy and take care of your skin. UMCC, your ultimate medical consultant connectors.